Okay, friends, welcome back. This is where nursing school starts throwing around words that sound completely made up. And one of my favorites is Fremitus, pronunciation, Fremitus. At some point, I thought they were making this word up. But before we get to that, let's talk about chest expansion. When we assess chest expansion, we're looking for symmetry. Both sides of the chest should move equally. Think about what happens if one lung isn't expanding properly. Maybe there's pneumonia. Maybe there's atelectasis. Maybe there's a pneumothorax. Suddenly, one side of the chest doesn't move as much. And that's a clue. Remember, assessment is clue collecting. We're gathering evidence about what's happening inside the body. When I think about chest expansion, I ask myself, are both lungs participating? Because if one side is lagging behind, something deserves a closer look. That's it for chest expansion. In part 2, we're diving deep into tactile fremitus and that cheat code I mentioned earlier. I'll see you there. Now let's get back to fremitus. The patient says 99, and you're feeling how those vibrations travel through the chest wall. Now here's the biggest cheat code from this section. Fluid carries vibration better than air. Let me say that again. Fluid carries vibration better than air, because this single concept explains almost everything. Imagine two lungs. One is full of normal air. One is filled with consolidation from pneumonia. Which one carries vibration better? The one with consolidation, the one with fluid. And that means increased fremitus. More vibration, not less, more. Because fluid conducts vibration better than air. Now let's flip it. Imagine a pneumothorax. Air collects in the pleural space. Or imagine a pleural effusion. Fluid collects outside the lung. Now those vibrations have trouble reaching your hand. The result is decreased fremitus. And this is why I don't memorize random findings anymore. I ask one question. What is happening to the vibration? Once you answer that, the assessment finding usually makes sense. Okay, friends, let's see if this is making sense. A patient has right lower lobe pneumonia with consolidation. What would the nurse expect to find during tactile fremitus assessment? Pause here and think about your answer. I'll give you a few seconds. The answer is increased fremitus, because fluid carries vibration better than air. That's the cheat code. And honestly, if you remember that one rule, you'll answer a lot of respiratory questions correctly. Let's lock this in. Chest expansion should be symmetrical. Fremitus is vibration. Fluid carries vibration better than air. Consolidation causes increased fremitus. Pneumothorax and pleural effusion usually decrease fremitus. And remember, you don't have to memorize everything. If you understand what's happening to the air and what's happening to the vibration, most of these findings start making sense. In the next section, we're tackling percussion. And that's where we'll start figuring out how to tell whether the lung contains normal air, too much air, or fluid.